this meeting of the Health Committee to order. I'd like to ask Councilor Fulbright to give the invocation, please.
Stand, please. Dear Heavenly Father, we thank you for all the wonderful blessings you have bestowed upon us. We thank you for all the little things that we take for granted that other people in other countries may not have. We ask that you will be with us today and guide us throughout these important meetings. Let us all be civil to one another and remember that we all have the Cherokee Nation at heart. We just have different ways of getting there. All these things we ask in your name. Amen.
Next we have a roll call. Please let us know you're here.
Bradley Cobb.
On.
Janelle Fulbright. Here. Bill England.
Here.
Bill John Baker.
Here.
Jack Baker.
Here.
Harley Buzzard.
Here.
Julia Coates. Joe Crittenden.
Here.
Jody Fishinghawk. Meredith Fraley. Here. Don Garvin. Tanya Porter Jordan. Present. Curtis Snell.
Here.
Chris Soap.
Here.
David Thornton.
Present.
Kara Cowan Watts. Honey, we do have a quorum.
Thank you. Next, approval of the June 20th regular session minutes.
Make a motion to be approved. Second.
First and seconded. All those in favor say aye.
Aye.
Any opposed? Motion carries. And we are to reports from the Claremore Service Unit. George Valera, you are the next contestant.
Morning.
Morning.
I think my report's in your packet. We're slowly closing in on making up the billing money that we were behind at the beginning of the year. Secondly, we actually met all, you guys are familiar with the GIPR goals, indicated the Claremore Hospital met all 21 of 21 for this year. So that's a plus for us. Yeah, it took some doing by our dental department. I take my hat off to them. Any questions? Yes, sir.
Can you just give us some bullet points on the upgrades to inpatient pharmacy?
The inpatient pharmacy, there was some talk about doing some chemotherapy there, so our area office came to the inpatient pharmacy and said they would upgrade it. They're not only putting in the positive pressure hood, they're putting in a negative pressure hood and rebuilding that and adding some square footage to it to accommodate the shelves and the new hood.
Okay, thank you. Any other questions? Guess not. Thank you so much.
Thank you.
All right. Next, Cherokee Nation Health Services, Melissa Gower.
Good morning.
Morning.
I've submitted my report. If you have any questions, I'll try to answer those. And just the one thing I want to mention is that yesterday we had a great celebration at Hastings. We were the first American Indian tribe in the nation to receive a Medicare incentive payment for meaningful use under electronic health records. So CMS was there from DC, the Oklahoma Healthcare Authority from Oklahoma City came and had a big check presentation, and it was a great event. So that's all I want to mention. If you have any questions, I'll try to answer those.
Any questions for Melissa? Councilor Fulbright?
Can you give us a little update on the dialysis center? I heard they started the groundbreaking.
They didn't show up yesterday. I guess you already knew that.
No, I didn't.
Last week, Mr. Woodliff at Tahlequah City Hospital sent me an email saying that they were going to break ground on Monday, which was yesterday. And so I called the clinic and said, make sure you've got the gate open so the construction crew or whatever can get in. And I just talked to Jennifer before I came over here, and she said they didn't show up. So I emailed Mr. Woodliff to ask him, why didn't you show up yesterday? And I've not heard back yet.
Okay.
So, but they were supposed to have started yesterday.
Councilor Buzzard?
Melissa, maybe you can explain how this works. A lady that lives in Delaware County, she had a job. Let me just kind of give you what's happening here. She had a job and she went to the clinic and she has the insurance. Went to the clinic, They made a referral, and it was for an ENT specialist, actually, so it was for. But the doctor has told her that she cannot drive, she cannot go to work. So, but the appointment they made was like September the 20th. Here we've got this lady, she's like the late 40s, and she really can't wait until September to just go see the EMT specialist because the doctor says you can't drive, so she can't work, so it's putting her a bind because she doesn't have any income coming in. And I think the appointment was made here in Tahlequah, and she lives in between J and Grove. And she was wondering why we couldn't refer her.
Did she ask her doctor that question, do you know?
No, I don't think so.
Okay.
I don't
If you'll
think
give me
so.
her name, I'll check on it.
Oh, okay. All right.
Just hand me your piece of paper with her name on it.
Okay, because what's happening, she's gonna be out of work until September, whatever, 15th.
I'm sure
20th.
they just don't know that, I'm sure they'll.
That's what I thought.
Yeah, if she didn't mention it to them, they may not realize that, so
Okay.
I'll take care of it if you'll
Okay.
give me your name.
Sure, I will. Thank you.
Don Garvin.
I just want to say job well done over at Muskogee. I noticed they have over 10,000 patients, and Wilma P. is 8,000, and Edward Smith about 5,000. So
Thanks
they
for
did a
that.
tremendous job. I just want to tell them, job well
Thank you, I'll
done.
pass that on. They'll be-
Congratulations, and
Thank you.
we'll give them a raise at the end of the year. Thank you, Mr. Chairman.
Thank you.
I continue to hear extremely positive comments about pharmacy at Nowata.
You know, our pharmaceutical issues are on the upside now. We've done a lot of things to try to relieve some of that demand, such that, you know, we just recently, within the first of the month, opened a new central refill and mail order pharmacy at Muskogee to pull that out of the clinics and put it there. That's been a tremendous help for them. We also have implemented a new program called Audio Care, which takes some of the manual labor out of that process. So we definitely have improved the pharmacy process flow issues.
Counselor Snell.
I would like to thank Hastings Hospital. I was involved in a car accident here a week so ago and got knocked out.
Oh,
They
mercy.
did sure will. They transferred me to Hastings, and I think they did a real good job.
Well, I'm sorry you had a car accident. I did not know that, but I'm glad that they did a
Don't
good
really
job.
remember it. It worked.
When I woke up, there was a stigma in his barrel.
Oh, yeah, CT scan, yeah.
So,
Well,
Real
good.
good.
I'll pass that on. Tk you very much.
yes, thank you.
They do a good job.
Any more questions?
I have a comment.
Counsel?
I forgot to tell you, I was a patient at Hastings as emergency, and I walked in and I've heard so many nightmares about the waiting room being so crowded, and I walked in and nobody was in the waiting room. I just went right up to the window. They took me right back, and I got Dr. Smallwood. She was excellent, and in no time flat, I had a CT scan. She came back 20 minutes later and told me what was wrong with me. I couldn't have had more excellent care than what I got at Hastings, and I was
Thank you.
really pleased with it.
Very good. Well, you either hit it on a lucky time or
Well, it was good on
a rare
Saturday,
moment.
so I guess everybody was out to lunch, I don't know, but I
I'll
have been there
pass
when it
that
was crowded, but
compliment
it
on
was,
also.
I
Thank
really
you.
received excellent care.
We have some
Very
great
nice.
staff there. Thank you.
Counselor Thornton?
I hate to be the bad apple in the,
No, we were on a roll now.
but I'm still getting complaints
Okay.
about pharmacies at Redbird and waiting periods.
Okay. If you'll send those to me, we'll see specifically
calls.
what that person issue is, or just email me their name when they call you, and let us look them up in the system and see, because we have implemented audio care at Salisaw, and they were the first clinic we put on the refill center because of that.
Usually it's a call about something else, but now I don't mean to complain, but we're having
Okay.
problems.
Well, if you'll try to get those to me so we can respond individually to those, it will help us see if there are still if there's still a process issue.
Okay, thank you.
Sure.
Council.
Melissa,
Yes.
next month, would you be so kind as to update us on the approximate waiting time on contract health services on the referral to be processed?
The-
Average.
Like the appointment made or the total process?
From the
or-
time it leaves the doctor's
Okay.
desk until we give them an appointment, and
Okay.
then how far out is their appointment?
Okay.
And then I noticed that I'm not real sure, it just says on contract health services, what's processed and what were approved. Is there any way that we could start seeing what the reasons might be on the ones that we don't approve?
On the denial diagnosis?
Just on the denial of the referral.
Let me see what I can do.
I mean, I don't want to
You mean
violate
number
HIPAA.
or you're wanting to know?
Well, I can see what the number is simply
Okay.
by the subtraction from what was processed.
So you're wanting to know if it was a cosmetic issue,
Yeah.
if it was a,
Or if it was something that could be handled in-house.
okay.
Maybe it's a test, but we already provide that test as a service at Hastings. I'm trying to find out, because I continue to get people saying, well, the process is too slow, or I can't get out. And I really want to try to get a handle on whether that's true or not.
And I'll try to see what I can do. But in the meantime, if you get those, if you will email me their name or send them to me, it helps us to look individually at those people to see what the issue was, to try to identify, is there a process issue, or was it just a complication with that one person, or, you know, exactly what the root of that issue is.
So what we'll find is that maybe it's possibly a doctor has referred them for something that we can take care of in-house. It sounded like on a few of them, that's the way it was, but
We are doing a lot
little
more
more
stuff
in-
in-house now
Yeah.
because we've enhanced our services so much.
are we still, when we send them out on contract health, are we still letting them go out to get the first service and then making them come back? If the doctor recommends something should be done.
And it can be done in-house, then it's done in-house.
Okay, so
Yes.
they're having to come back to seek a second referral?
Oh, yeah, you always have to do
Okay.
that.
And-
You have to do that because of budget type, keeping a track on the cost of money. Otherwise, you would never know what their bill's gonna be if they go back, you know,
And
10
this
times.
may be
The
hard.
only one we do a little different is cancer, and we actually approve those in cycles.
And this may be a little hard to do, but if we could, when they come back on that second referral, if the doctor has recommended something, if we could kind of get some idea of what our reasonings are for keeping them in-house versus sending them on out.
Well, the only reason we would keep them in-house is if it's a service that we provide in-house.
And the lag time if we have to send them back out.
The same question about the doctor's desk to appointment time
Yeah.
to appointments? Okay.
I guess what I'm asking you to do, if you could, is expand on that contract health services, because that seems to be where I get a lot of feedback from the public, either positive or negative.
And if you email those to me, I always respond to you, you know, also to Diana saying,
And I don't want to.
we've contacted the patient, or this was this issue, or whatever, so we will try to explain each one of those.
And I don't want to get us in a situation where we're violating HIPAA or something.
No, I would never
Of
do
that
that.
nature, but if we could get a better handle on that area, then maybe we could give them better responses as the public asks us questions about that. And then just one other.
And if it's at Hastings, the other alternative is we have a patient advocate there that's very good, Star Lynch, and you could refer them to her. I mean, that's what I do. If I
She's
get,
the patient advocate.
if I get a complaint or something about Hastings, I email Star and she follows up with them.
That's good to know, because I did
Yeah,
not know.
she's
that
really
was her.
good.
The only other thing and this is just a personal thought, and I brought it up before. Can you put the phone number on the pill bottles of the,
Didn't I respond to that?
I don't remember that we ever talked about it
I think I
again.
responded in
I
email
still
to that. I
did,
think I checked on it.
If there's any space left on
Well, the
that
issue that, if I remember correctly at the time, and I stand to be corrected based on my email to you, but there are, some of our facilities, because of the system they were operating, actually prints the refill number on there. And then there was a few that just prints a number, but it's the clinic number. And the reason it was because of a different type of phone system they were on. We're trying to get all of those on the same phone system, but because of some of the local telephone companies, it's been a little more difficult to do. And so there is a phone number on them, but some of the facilities had the refill number and some of the facilities had the clinic number.
Hastings has the clinic number, and I'm continually getting stopped when I go to the hospital.
I'll get an
for-
update on it.
For the medicine, the little ladies there are saying, we can't ever find that number to call the refill line. And I told them I'd bring it up once again.
I'll get a follow-up on it. I know there was a reason, but I don't remember what it
Usually
was.
when I go in and turn to go to, over to the medicine part, there's gonna be 10 ladies sitting right there by the windows.
Okay.
And all 10 of them's gonna stop you and say, I can't find that number. So
Okay,
if we could put it on there, it would be very helpful, I think. to a
okay,
number
I'll
of
check
people.
on it.
Counselor Callan Watts.
Thank you, Mr. Chairman. So, would that be typical, like the process for contract health referral would, I mean, that there's similar parallel processes even if they have private insurance and we're going through regular clinics and hospitals and their own doctor. Is that correct? There would be somewhat similar?
I'm not sure I understand your
I know on my
question.
private
I'm sorry.
insurance, nothing magically happens overnight and I can't just snap my fingers and get approved or these other things.
Okay.
So how do we compare to the private industry? Not that we can't do better than the private industry, but I'm curious, how do we do compared to the private industry? Because I have to call Blue Cross Blue Shield or whoever is my private insurance provider, and often if it's and ask for,
Okay.
it's not all automated for me. It's, things I have to fill out forms or I have to make phone calls. I have to wait for something to be approved. So how do we do compared to private industry? And then on the exceptions, are any of those exceptions the same as they would be for my insurance? So if I go skydiving and I break my neck or something, would private insurance cover that? Do we cover that? Should we cover that? How many of those contract health referrals may fall into those? If I go out,
Okay.
Okay,
well, let me answer the last question first.
Okay.
The last question is, we do have an exclusion in our medical priority list for risky activities.
Do we track those exclusions as part of the contract health?
They would be a denial. It would be denied based on that it doesn't meet medical priority.
Do we track that and can we keep that as a separate line then that due to these?
I don't know the answer to that. That's what I've got written down. I'm gonna
Okay.
have to see. But I can tell you that our CHS processes, we've worked really hard the last 2 years on those processes to try to make them more efficient.
Okay.
Part of our, and this is not an excuse, but part of the issue is just pure demand. You can look at our CHS referrals over the past, so many years, and it's just skyrocketed. I mean, we went from working 500 a week to 1,000 a week, or even more than that. So part of it is demand. Okay, the second part of it is that we, within the last year, have put in productivity standards and national guidelines on the number of time, and we track the number of days it takes to get an appointment from the time your referral is initiated. We're tracking that as a measurable outcome for our CHS staff, and they're evaluated as one of those
Okay.
on their scorecard. Okay? How does that compare to the private sector? I think it probably depends on what type of insurance you have, whether you're in a HMO, a PPO, or some other mechanism. But you're absolutely right. I mean, even in the private sector with your insurance, you know, there are approval processes for those things. The other thing I was going to say is from the time of the time the appointment's received until the appointment date, that varies on the provider you're getting the appointment with. And I don't know if you've been to some specialists lately, but it's, you know, their schedules are getting tougher and tougher to get into. Sometimes you know, depending on the circumstance, you can't get in this week. I mean, you have to wait. Sometimes it is September, that's 2 months away, and sometimes it takes 60 days to get into some specialist, depending on, you know, what your issue is and whether it's urgent or emergent, or you're an established patient, or you're not a new patient. I mean, some people don't even take new patients anymore. So I just am trying to say that there's lots of variables. But we do have system and measurable objectives in place to try to control those things.
Okay, so I heard 3 additional things. First of all, I heard that the published phone numbers may or may not be accurate or complete somewhere.
That was on pharmacy labels for refill.
Okay, so can we do a review?
Right.
Because this is not just health. I've actually found this with the housing authority too. That the phone books and all the paperwork and everything else, make sure that the phone numbers are correct. And going to somebody that has a voicemail that would return phone calls and those kind of things. So that also lends itself to the patient handbook and the availability of the patient handbook, or a card that has all those numbers on them. That would be my second issue.
Okay, we're trying to do that a couple of ways. One is we try to update our patient handbook on a yearly basis. And the reason it's not done more than yearly is because of the printing cost and being able to, you know, when you update it, we have thousands and thousands of copies printed, so the economies of scale, and then it takes about a year for that to run out. So we try to do that on a yearly basis to update all that. Phone numbers in our system doesn't usually change that much. I mean, our clinics have had the same phone number since they were created. So in our system, what has changed recently has been some of the refill numbers, and that's not because the numbers so much change, but because our systems have changed to be more efficient. So instead of calling the clinic and them transferring you, which you still can do, you can still call that clinic number on there, and they will transfer you to the voicemail or the refill center. So, we do try to do that.
So my third point would be that an ombudsman of sorts. Maybe Hastings Hospital has social workers that are served within that system, but I know that our Rogers County and Tulsa County Cherokees are often left out of how to navigate the complexities of Indian Health Service and what we do provide through Cherokee Nation Health Services. So what happens is we've got the HIPAA requirements, and you've got council people that may or may not, even though I think I had HIPAA training about 7 years ago from your department. But I just don't see that elected officials should appear to have a magic wand to take care of health care issues of any sorts. And then we're inundated, and I'm not saying you guys, we do, I think, a pretty good job considering the amount of emails and phone calls we get. But then it becomes this really complex deal where we have like 5 people potentially that may or may not be HIPAA, you know, and working on somebody's individual health issue, and that doesn't deliver for that individual. So maybe if we had like an ombudsman of sort, because I know some of your staff have always been go-to people, and I inundate them with requests, and they're great about getting it done. But I don't know that that's appropriate, because I'm taking them away potentially from their actual workload that they should be focused on. I'm just throwing that out there.
Well, a couple of things. One is, our established process, which is Diana Turtle, and she's sort of your ombudsman for service issues, okay? And then she sends that to me, and I send it to the appropriate person in our system, depending on what the issue is. They respond to me, and I respond. And usually, sometimes that's done in one day. I mean, I'm pretty good about getting those out and getting responses. And I track them on my computer, and I don't delete them until I know that I've gotten a response and responded. So I really do take those serious and try to respond to those. The second thing is, we do have patient advocates at Hastings and at the majority of our clinics. And I, off the top of my head, can't tell you which ones don't have them yet. But our intent is to have one at every clinic. Always the clinic administrator is there and is a great resource. So it's always nice if you have a patient that's calling you about a concern at NOWADA, let's say, ask them to call Cindy Collins. Ask the patient to call Cindy, because Cindy can't talk to you about the patient, but she can definitely talk to that patient.
Two things then. One, I need a list, I'm sure the rest of all
Okay.
these patient advocates and their associated
Well,
clinics.
okay.
If we're gonna do that, then we have to know who they are and how to reach them. And then
Okay.
second, we want a
Well-
dedicated person just for our areas that are caught in between Indian Health Service and Cherokee Nation Health.
Well, do you have patient advocate at Claremore? So who does patients go to if they have you? Oh, well, he's the patient advocate then.
I don't think that's fair to
But
our
that's his
citizens.
decision, I mean, that's his system.
They go to you, and then you guys, you call me.
So Buell, how do you feel about this?
And then I do what she does, I send them. That's exactly what I do.
That's what I do, I send them to George, and he's really good about responding to them.
People here, and I think we've gotten everybody covered when they do send something.
But I'll definitely get you a copy of each clinic
I'm
administrator
fine if you want to talk, come up to the
to
microphone.
refer the patients to.
I want to make sure, because we do have people listening, so.
Okay, thank you, Mr. Chairman.
I think that's good discussion. I think there's some things in there we need to think about, and not that we're not doing a good job. I think it's something definitely to think about, because health has gotten to the point that it's so big that I'm not sure that, and I could be incorrect on this, but sometimes I feel like as a counselor, I'm having to do some things as far as directly with the patient. And doing some things, in my case, is I end up talking to the clinic director, and I'm not sure that's fair to them, because they've got a big responsibility. And I could be wrong on that. Maybe they enjoy it.
That
that's what they
is
like to
fair,
do.
that's our job.
Okay, that's fine. I just,
And
sometimes
if I
feel like
haven't
I'm taking
responded
away
to someone, please let me know, because I take it very seriously and I track my inquiries.
I can honestly tell you from my own perspective, when I've made a phone call, within 24 to 48 hours at the most, I got an answer for somebody. It's just, I just want to make sure I'm not pulling somebody off something they need to be doing.
No,
Okay,
that's our job.
Councilor Buzzard.
And I will attest to what Melissa's saying. She's really good about getting the questions answered that I ask. And it seems like, sometimes I feel like I'm the only one, but I guess I'm not. Right? But,
No, trust me.
and I think we've talked about this, and I've learned some things just by listening here, but I guess what we're saying then, Melissa, if, I'm going to take Ortho. I had a patient tell me that there was like 300 to 400 that was sitting at Hastings Hospital waiting to be determined who gets priority to go to take care of their problems. Should the patient actually be telling their provider at that time, like the scenario I gave you a while ago, that
Absolutely.
and I think that's what they're missing. A lot of times they'll just go in and say, well, I've got a finger that's out of place, and the patient or the provider will just say, well, we'll get your referral. Well, it may be 4 months before that patient can get in, and they're still having a problem with the finger.
And as Kara mentioned, the patient should be calling us back or going back up there and saying, this is my problem. I need to go to work, and they've written me this.
Yeah.
I mean, because you can't do anything. I always tell my niece and nephew, I can't do anything about your situation if I don't know about it. whether it's me, the doctor, the nurse, CHS, or whoever it is.
And I think what's happening with the providers, I guess they're not asking those questions. They just say, well, you know, you need to have a ear, nose, throat specialist to look at you, and, you know, we'll get you a referral, and it's 2.5 months out, without knowing what the problem really is. That, hey, I've got a job, and they won't let me come back to work.
Right, and when they go over to Contract Health to schedule that, if they would just say, you know, this is the situation I'm in. I mean, I'm sure they would work with them, I can't imagine. If they aren't, then I need to know that too, because that's a performance issue.
Okay. Good. Thank you.
Any more questions?
Thank you.
Thank you. We're down to old business. There appears to be none. New business appears to be none. There are no announcements that I can see. I will entertain a motion for adjournment.
Second.
First and second, all those in favor say aye. Aye. Any opposed? We're adjourned.